Hey there, fellow students. Here's some practice questions on cognitive behavioral therapy. Question 1. A new nurse asks you, the NP, how can I be sure I'm developing a therapeutic environment on my unit? Your response is based on the fact that a therapeutic milieu by a nurse is characterized by what? A. A rigid adherence to timeliness and unit routine. B. Relaxation of boundaries when doing so is accepted by all. C. The focus of the staff is directed to the most critically disturbed patients. Or is it D. Specific patient-centered goals are established mutually by patient and staff? The answer is D. Specific patient-centered goals are established mutually by patient and staff. So, factors that determine the therapeutic effectiveness of social environment include the presence of two-way communication between patients and the members of the multidisciplinary team for purposes of goal setting. In a therapeutic relationship, boundaries are established early and maintained throughout, and although adherence to routine is important, there is room for adjustments when it benefits the therapeutic nature of the milieu. Although short-term attention may require focus on the patient in crisis, attention of the staff is equally shared. Question 2. Which statement describes the primary purpose of boundaries? A. Boundaries define responsibilities and duties to oneself in relation to others. B. Boundaries determine objective of the various working stages of the relationship. Or is it C, boundaries differentiate the assumed roles of both the nurse and of the patient? Or is it D, boundaries prevent undesired material from emerging during the interaction? The answer is A, boundaries define responsibilities and duties to oneself in relation to others. So boundaries are social, physical, and emotional limits of interaction. As such, they serve to define the responsibilities and duties of the nurse in relation to the patient. Objectives and roles are determined during the orientation phase. Emergence of undesired material may be a significant issue for the patient. Question 3. You are determining whether the patient needs could be best met in task or process group. The decision is based on the understanding that a task group focuses on what? A. Content issues. B. The here and now. C. Communication styles. Or D. Relations among the members. The answer is A. Content issues. So content-oriented group focus on goals and tasks of the group. Thus, a task-oriented group would focus on content issues. Process groups, they focus on interpersonal relationships. Communication styles are not relevant to describing task orientation. Here and now, well, that refers to dealing with issues that are taking place at the present time. Question 4. The treatment team was engaged in planning how group therapy could be included as part of the structured daily activities of the unit. A new team member asks, why is it so important to include group therapy for patients? The most accurate response would be based on the assumption that A. Hidden agenda frequently surfaces in group sessions. B. Some persons do not relate well on an individual basis. C. Group therapy is much more cost-effective for patients. Or is it D. Psychopathology has its source in the disorganized relationships? The answer is D. Psychopathology has its source in disordered relationships. So a key assumption of group therapy is that psychopathology has its source in disorganized relationships. It follows that individuals will behave in group as they do in other settings, so group provides an opportunity to help individuals develop more functional relations. Ability to relate is not relevant to the group work. It is dealt with on a one-to-one therapy. Hidden agenda is not a reason to offer group therapy, and cost effectiveness is not an assumption about the reason group therapy is effective. Question 5. Which patient would the group co-leaders determine is demonstrated in Yalom's therapeutic factor termed universality? Is it patient A, who states he realized he is not the only person with a problem with loneliness? Patient B, who displays dysfunctional interaction patterns learned in his family of origin? Or is it C, patient C, who states that he finally feels a strong sense of belonging? Or patient D, who openly expresses his anger about his work? The answer is A, patient A, because that's who states he realizes he is not the only person who has a problem with loneliness. So universality is the factor that refers to the understanding that one is not unique, that others share thoughts, reactions, and discomforts like your own. Dysfunctional interaction refers to the corrective recapitulation of the family group. A strong sense of belonging provides an example of cohesiveness. Display of anger is an example of catharsis. Question C. Which statement by a 16-year-old is considered a positive evidence that the family involvement in therapy is moving them toward an effective functioning? A. My dad has finally stopped giving me advice on how to live my life. B. I stopped playing football since practice required me to be away from home so often. C. Since my mother quit her job, she is much more available to keep the home running smoothly. Or D. Eating dinner with my parents on Sunday nights have helped us to be more aware of each other's needs. The answer is D. Eating dinner with my parents on Sunday nights has helped us to be more aware of each other's needs. That statement is the one that shows the family has made an effort to improve communication and deal with alienation without one member bearing complete responsibility. Withdrawn from the team suggests he felt solely responsible for the family problem. Quitting the job suggests that the mother saw herself as responsible. However, home does not guarantee unification. A lack of investment suggests that withdrawal of the father from participation in family matters. Question 7. In response to the provider's statement, "Tell me about your family," the patient became silent and displayed nonverbally that he's uncomfortable. Which statement by the provider reflects sensitivity to the patient? Is it A, "Oh, I'm sorry, I didn't realize your family was a problem for you"? Or B, "Learn to express negative feelings will assist you in getting well"? C, "Perhaps you can talk about your feelings to the physician next time you meet"? Or is it D, "That seems to be a difficult subject for you. We can discuss when you're ready"? The answer is D, "That seems to be a difficult subject for you. We can discuss it when you're ready." This response acknowledges the situation, is respectful, and allows the patient to choose when to refocus the therapeutic interaction. Referring to the family as a problem is not sensitively worded. Offering false reassurance implies that feelings are negative. Suggesting postponing the discussion represents avoidance of dealing with the patient's feelings. Question 8. When sharing her feelings about separating from therapy group, the patient states, "I feel a little bit sad and empty that I won't be seeing you folks again." What is the most accurate evaluation of the patient's statement? Is it A, it indicates regression and her lack of readiness to terminate? B, unconsciously, she is hoping she will be permitted to continue the group? Or is it C, she is demonstrating normal feelings associated with the termination of therapy? Or lastly, is it D, she needs further evaluation by her therapist to determine readiness to terminate? The answer is C, she's demonstrating normal feelings associated with termination of therapy. The patient is expressing feelings of sadness over the loss of the therapeutic group relationships that has been helpful to her. Such feelings are considered normal, just as they are considered normal when the nurse-patient relationship terminates. The feelings expressed are normal and not regressive. No hidden meaning is present. The patient openly expressed genuine feelings, and further evaluation is not needed. Question 9. A patient tells you, "I really like you. You're the only true friend I have." The patient's remarks calls for you to revisit the issue of what? A, trust, B, safety, C, countertransference, or D, boundaries. The answer is D, boundaries. The patient's remarks call for you to remind the patient of the parameters of the provider-patient relationship. The remark would also give the NP an opening to discuss the matter of friendship. The patient's remarks do not suggest a need to deal with the trust, safety, or countertransference. By the end of the orientation phase, which outcome can be identified for a newly admitted patient? The patient will demonstrate what? A, the ability to problem solve one issue. B, trust in at least one nurse on the unit. C, positive transference with a staff member. Or D, ability to ask for help in meeting needs. The answer is B, trust in at least one provider or nursing staff on the unit. Establishing trust in the nurse is a fundamental task of orientation phase of the relationship. Thus, it is an appropriate outcome to identify. When trust is present, the patient is free to focus on the work and task of therapy. The ability to problem solve is an outcome appropriate for the working phase. Positive transference would not be an identified outcome, and the ability to ask for help would not be an identified outcome for the orientation phase. Question 11. The patient and the nurse have agreed on problems to be addressed during a short course of outpatient therapy. At the beginning of the appointment, the patient states, "I'd like to work on the issue of the relationships today." Which assessment can be made? A, nurse-patient roles have not been clearly delineated. B, the nurse should suggest several alternative behaviors. C, the patient must be able to manage emotions before continuing. Or is it D, the relationship is moving forward from orientation to working phase? The answer is D. That relationship, it's moving from orientation to working phase. Fabulous. So once the patient and the nurse have collaborated to define and prioritize problems, the relationship moves from orientation to working phase. The remaining options, they don't have any relevance to the scenario since there's no reference to roles, alternative behaviors, or managing behaviors. Question 12. A nurse and a patient are entering the termination phase in the group experience. An important nursing intervention will be to what? A, encourage the group to describe goals for change. B, inquire whether the group needs more time to accomplish goals. C, assist the group to explore alternative coping strategies for problems. Or D, discuss feelings about leaving the group and the support found from the group. The answer is D. We want to discuss feelings about leaving the group and support found with the group. Healthy termination is facilitated when the group and nurse expresses the reactions to termination. The nurse serves as a role model by being open and genuine as the feelings about the losses incurred and ending are discussed. On a positive note, accomplishments and growth are acknowledged and the transfer of safety and trust to the group members is accomplished. Describing goals is accomplished in the orientation phase. Accomplishments is part of the working phase in the relationship that does not have a strict time limit. Exploring alternative coping strategies would be part of the working stage. Question 13. A patient attended group therapy mentions, "In the beginning, I was sick, so sick that everyone had to help me. For the last few days, though, it's felt good to be able to give something back to the group." This statement can be assessed as an example of Yalom's factor of A, altruism, B, harmonizing, C, cohesiveness, or D, imitative behavior. The answer is A, altruism. So what does the altruism refer to? It refers to the experience of being helpful to others and is clearly what the patient is displaying in this scenario. The other factors are not applicable. Question 14. When another patient serves as an alter ego during an outpatient group session, the nurse documents that the group has been engaging in what? A. Role-playing, B. Psychodrama, C. Cognitive therapy, or D. Consensus building. The answer is B. Psychodrama. What is psychodrama? Well, that uses spontaneous drama to act out emotional problems to promote health through the development of new perceptions, behaviors, and connections with others. Others in a group take the role of significant others. Role-playing and cognitive therapy do not use the technique or alter egos. Consensus building is not a form of therapy. Last question, question 15. The nurse is collecting the paintings from the patients after the art session is over. After art therapy, a patient hands the nurse a paper that consists of several black scribbles. Which statement demonstrates the nurse's understanding the goals and the objective of the therapy? Is it A, do you want to complete your painting? B, I see you didn't take this very seriously. Or is it C, can you tell me what happened to prompt you to do such work? Or is it D, oh goodness, thank you, I'll put that away in a safe place for you? The answer is D. Thank you. I'll put it away in a safe place for you. So art therapy, it's used to help resolve conflicts and promote self-awareness. The nurse should not comment on the quality of the art or the patient's talent, but rather treat the project with respect and value. The work is simply each patient's self-expression. The other options make judgments about the work or the patient's willingness to participate. All right, good luck on your test.